Now, let's bring you to Johannesburg, where the Minister of Health, Dr. Zweli Mkhize, will visit the Charlotte Maxeke hospital this afternoon to assess damage from the fire that took place at the weekend. Since that blaze, the hospital has been closed and patients have been moved to other facilities in Gauteng. Masego Rahlaga is joining us now on the Midday View at this hour. She's been tracking this story for us just to set the scene for us ahead of the Minister's visit this afternoon. Good afternoon, Masego. Thank you very much for your time. I mean, just very quickly, yesterday you spent your time going around some of those hospitals like Chris Hani Baragwanath that have received patients from Charlotte Maxeke. That facility is still shut down, but the COVID-19 vaccination facility that's based there has not been affected by the fire. So we guess the Minister will want to check as well to see how ready is that facility for phase 2 of the rollout.
Well, that's correct, Bradan. That part of the hospital is very far from where the fire occurred between Friday and Saturday, so it's still operational. When we were here yesterday, we did witness that there are already people who are there and healthcare workers who are still being trained in terms of phase 2 of the vaccination rollout. So that part of the building was not affected at all. It's in fact outside. It's sort of outside the hospital. But in terms of the Minister's visit today, we've already seen the MEC of Health in the province driving into the hospital just moments ago at around 1 o'clock exactly, Bradan, her VIP protection vehicle driving her into the premises. We're expecting her to be joined by the Premier, David Makhura, on this visit, and of course the Minister of Health, Dr. Zweli Mkhize, to also be here. Now, Bradan, the complaints from a lot of unions have been that health and safety regulations have not been followed at this hospital, but not this hospital in particular. Actually, a lot of the other unions, or a lot of unions rather, saying that this is not only a problem at Charlotte Maxeke Hospital, it's a problem at even health offices, head offices. As you remember, the Lisbon building, which was actually brought down about last year or the year before because of firefighters not being able to stop or extinguish a fire at that building, 3 of them passing away. So the union's making that as an example, as well as a roof collapse. If you remember, Bradan, around March 2017, there's a roof that collapsed at this facility, Charlotte Maxeke, and therefore, that's what the unions are saying is the reason they're saying that there should be an investigation, because health and safety protocols are usually not followed.
Okay, Masego, so to my mind, from what you've just said, the Minister's visit could have like 2 buckets, so to speak. The one bucket is to, of course, check that vaccination facility in terms of phase 2. The other one will be post the fire and the concerns expressed by trade unions around about occupational health and safety. The Minister of Health is going to have to maybe assess the damage that's been done there and maybe ask the officials who are running the hospital, how safe will it be going forward?
Yes, I do think that there'll be some tough questions that the officials here will have to answer. I think that the CEO of the hospital, Gladys Bukhoshi, would also be here to answer a few questions. Of course, we expect that the company that's been hired by the Infrastructure Development Department in the province to assess the damage, particularly with the engineering and the structural engineering of the building, we expect those people to answer questions for us. As you know, the announcement of a 7-day closure by the Premier was explained to us yesterday by the City of Johannesburg's EMS official, who said that those 7 days are for them to actually assess the building, because it was handed over to them on Saturday. And so they'll have to go back to the Premier and explain to him whether or not it is actually possible to reopen the facility after 7 days and have full service for the patients who need services at the hospital. So the other thing, Bradan, about the visit inside the hospital by the Minister is also going to be quite problematic, because we found out from the EMS that the damage caused was quite dire, and as well as another structural collapse and some poles actually and pillars in the hospital also starting to cave in. So I don't know about the possibility of us gaining entry into the hospital.
Yes, you said the NEC for Health for Gauteng is already there. We expect the Premier of Gauteng, David Makhura, to accompany the Minister. Charlotte Maxeke is in Johannesburg. That's the capital of the province of Gauteng. And there have been calls for a probe into that fire at Charlotte Maxeke, for example. I guess that's another question that's going to have to be addressed. How open is government, and when will government start such a probe? Because someone has to be held accountable.
So far, we haven't heard anything about foul play, Bradan, and that's what the Premier said when he was here on Saturday as the firefighters battled the fire that restarted on Friday. So we haven't heard anything about any arrests, for instance. So far, we just know that the government is saying they're not suspecting any foul play. But I think the investigation by the emergency services officials in the city of Johannesburg, as well as the structural engineers, will probably be able to, advise the Premier as well as the Gauteng Health Department on whether or not there should be a criminal investigation, whether it's for arson or even for anything found to have been wanting in terms of health and safety protocol that was supposed to be observed. So as you remember, Bradan, I think you spoke to Kaya Kaba of the union Nehau, and he was telling you that some of their members who work at this hospital were saying that they've never done things such as, for instance, a fire drill. You'll remember that the firefighters were complaining about not being able to access water at the fire hydrants that were outside the hospital, and that's why it took so long. Private companies had to come in to assist to put out the fire, and that's what prolonged the entire process of putting out or extinguishing the fire here at Charlotte Maxeke. So those are the questions we'll definitely be able to pose. We'll definitely also ask about the amount of money that it will cost. But then, as you know, the fire started in a storeroom where, very important equipment such as PPE is stored already. We know that in South Africa we've had a lot of PPE scandals. Before COVID-19, the nurses and doctors we spoke to here on this channel had been telling us numerous times, Bradan, about not being able, not having adequate access to PPE. So when the coronavirus pandemic arrived in South Africa, that obviously was exacerbated, and we knew that the problem was so dire. So that also is another issue. It means more money and more budget will need to, be allocated in terms of making sure that the health workers who work here, eventually when they come back, there is adequate PPE. So there's money there. There's money about the infrastructure that needs to be fixed. Of course, we know that none of the wards were burnt, but because of the smoke that went on, the fire caused so much smoke that nobody can actually go into any of the wards at the moment because of smoke inhalation. So that 7-day mark, Bradan, I would say that is probably not going to be possible for full service to commence.
Yeah, it's going to take quite some time. And the minister expected that about 2 o'clock this afternoon.
Yes, but then the minister is expected here at around 2 o'clock, and for the minister to actually come to Charlotte Maxeke shows you how important this hospital is. Not only is it a hospital that was one of the first 5 hospitals identified to deal with the coronavirus pandemic from March last year when we had patient 0, it's also a hospital that specializes in a lot of care. So, for instance, there's not a lot of hospitals that do certain surgeries such as hip replacements, etc., around South Africa, except this one. This is also a hospital just like Chris Hani Baragwanath Hospital, a very important one in the continent. It services a large part of this entire continent. So it's a very important hospital, and it's also a hospital that, for instance, offers oncology for patients suffering from cancer. It offers chemotherapy. So it's a very important hospital, and the minister coming here to visit the hospital is very telling of how important Charlotte Maxeke is.
Thank you very much for that update. Masego Rahlaga outside the Charlotte Maxeke Johannesburg Academic Hospital.